This module is designed to help you understand the key components of enrolling in private health insurance plans. By the end of this module, you will be able to explain to your clients when they can enroll in private health insurance plans, what financial and healthcare-related questions they need to consider when selecting a plan, and how to explain the differences between plans. We will also provide an example of a pre-screening on healthcare.gov so you know how to help clients review their plan options. For most insurance plans, you can only enroll or switch plans at certain times during the year. These time periods are called open enrollment. The open enrollment period may be different depending on what type of health insurance you have. People can enroll in Medicaid at any time during the year, but they can only change their managed care organization during Medicaid open enrollment. If you've had a life change between open enrollment periods, you may be able to enroll in a new type of plan or switch plans. This is called a special enrollment period. When in doubt, if there's a change in income or family size, ask. Open enrollment for Medicaid, Medicare Part D, and healthcare.gov are usually in the fall of each year, with plans beginning on January 1st. Many of the different types of insurance have overlapping open enrollment dates. This can be confusing for clients who may not know what type of insurance they have. If in doubt, clients should meet with application assisters during the overlap period in November. That way, no matter what type of coverage they have, they will be safe. Clients should receive letters in the mail from their insurance company or communication from HR if they're enrolled in employer insurance, letting them know when it's open enrollment. However, sometimes the letters for clients enrolled in insurance plans on healthcare.gov may be scary or confusing because they do not reflect the correct payment assistance amount. The letters reflect the new premium costs, but the previous year's payment assistance amount. It's important to remember that as premiums increase, so does the payment assistance clients are eligible for. You should also remind clients that new insurance plans are available every year. Even if their current plan becomes too expensive, there may be other plans that better suit their needs. Don't let sticker shock keep people from seeking coverage. It's important that clients keep their address up to date with their insurance company and read all their mail so they don't miss out on important information. If you are not a health insurance expert, don't worry. You don't have to be one. There are people in the community who can help. If you are not the person trained to help folks enroll in health insurance, make sure you have your community resources ready. It may be good to meet local application assisters or shadow them. Emphasize with clients that application assisters in the community are there to help people understand these decisions. The assistance is free. Application assisters can help clients understand their options, but they will not guide clients in a certain direction or recommend a specific plan. Application assisters can help people with both Medicaid and Marketplace plans on healthcare.gov. Remind clients that if they get health insurance from their employer, the Human Resources Department may be able to help answer questions. Remind folks that if something in the family changes, like you lose your job, have a new baby, etc., then eligibility for Medicaid might change. They can go to an application assister for help. State Health Insurance Assistance Programs, or SHIP, resources can help with Medicare counseling. While costs may be top of mind for many people, when choosing health insurance, we need to think about the adequacy of coverage too. Would the out-of-pocket costs be affordable, or are current providers or specialists in the network? If we need physical therapy or a chiropractor, how many sessions are covered? If I hope to get pregnant this year, is the hospital I like in the network? Are my medications covered? Many people want to choose the plan with the cheapest monthly premium without realizing the plan might not work for them or cost more in the long term. Before looking at plans, clients should make a list of their providers, medications, and any services they expect to utilize over the next year. The Centers for Medicare and Medicaid Services has a helpful booklet called From Coverage to Care. This booklet provides a roadmap for going from enrolling in health insurance to understanding and utilizing the coverage. It includes helpful information like definitions for common health insurance terms, examples of insurance cards, an explanation of benefits, as well as steps to choosing a provider. This resource is available as an online tool, and printed copies are available for order from CMS. Buying health insurance is somewhat of a risk. You may pay monthly premiums and then never actually need the coverage, or you may fall ill or have an accident and need very expensive health services that would be even more expensive without coverage. We just never know what life will bring us. Having health insurance can provide a sense of security, but it should not financially strap us either. It's important to remember that there is no one best plan. Everyone's life situation is different, and everyone has different levels of risk they are willing to accept. The good news is that it is never your job to choose a health insurance plan for a client or community member. Your job is to ask good questions, help them understand the terms and the math, and get them to make an informed choice about what seems best for them and their family. There might not be one plan that checks every box in a client's wish list. Clients will need to consider what is more important to them: a low monthly rate, lower costs when utilizing services, knowing what to expect, or being able to keep their provider. Some important costs clients should consider include the monthly premium, how much tax credit they are eligible for, and whether or not they want to use the full tax credit amount, the annual deductible, co-payments for primary care, specialist visits, and prescription drugs, the co-insurance, and the out-of-pocket maximum. An experienced application assister shared with us that people often overlook out-of-pocket maximums when considering which plan to choose. Sometimes a deductible can be low, so people think the plan will save them money, but the out-of-pocket maximum can be high, meaning that folks will still have to pay a lot of money before the insurance kicks in to pay 100% of the costs. For some high deductible plans, the deductible and the out-of-pocket maximum may be the same thing. Out-of-pocket maximum is the most you pay during a policy period, usually 1 year, before your health insurance plan starts to pay 100% for covered health benefits. It includes deductibles, co-insurance, co-payments, but it does not have to include premiums or spending for non-essential health benefits or non-covered services. Each plan has a summary of benefits that includes examples of plan costs for diabetes management and a normal pregnancy. The examples are designed to help consumers compare costs, but they often confuse clients. Application assisters report that clients sometimes call back and wonder why their actual costs do not match up with the ones on the examples from the summary of benefits. I usually pick out a couple different examples that build on each other. For example, you have surgery and meet your deductible. Then, a couple months later, you have to get an MRI. Because you've already met your annual deductible, you just have to pay the co-insurance, which is a percentage of the total cost. Get out your calculator and do the math with the client. This is a good way to show how the deductible, co-insurance, and out-of-pocket maximum work. I've also had clients think that they have to meet their deductible for the year and ask if they can set up a payment plan with the insurance company. It's important to make sure clients understand that they might never reach their deductible if they're healthy and don't utilize services often. If the person has a vehicle, I usually use the example of car insurance. Just like you only have to pay the car insurance deductible if you get in a wreck, you also only have to pay the deductible if you get sick or injured. The health insurance marketplace has 4 different levels of coverage: bronze, silver, gold, and platinum. As the metal level increases, the premiums usually increase and the out-of-pocket costs decrease. Typically, bronze plans cover about 60% of medical expenses, Silver plans cover 70% of medical expenses, Gold plans cover 80% of expenses, and Platinum plans cover 90% of expenses. Some clients may also be eligible for catastrophic plans. Clients can choose a plan at any of these levels and still get a tax subsidy to help pay for their monthly premium, as long as their household income is below the income limit. Additionally, certain low-income households are eligible for cost-sharing reductions if they choose a silver level plan. These cost-sharing reductions lower the deductible, copays, and out-of-pocket costs, so the client gets the best value with these plans. Outside of open enrollment, clients can still enroll in coverage if they've had a life change, known as a qualifying event, in the last 60 days. Some examples include getting married, having a baby, moving to a different coverage area, or losing other health insurance. If someone applied for Medicaid during open enrollment or during a qualifying event and is denied, that is also a qualifying event. Clients may need to submit proof of the qualifying event, like a marriage certificate or a termination letter from other insurance. You can enroll in Medicaid or CHIP at any time if you are eligible, even if it's been more than 60 days since the qualifying event. Healthcare.gov has a pre-screening tool you can use to get an estimate of how much payment assistance and cost sharing you might be eligible for. The pre-screening tool will also let you know if household members may be eligible for Medicaid or CHIP. The Benefied website also has a pre-screening tool you can use. There is no wrong door. If someone applies on healthcare.gov and is assessed as being potentially Medicaid eligible, the Marketplace will transfer their application to state Medicaid office and vice versa. You may still need to submit documents such as proof of income or immigration documents to complete the application. Let's try pre-screening for a household of 2 with an annual income limit of $30,000. You will need to include the information for everyone in your tax filing household, even if they aren't applying for health insurance. The pre-screening asks about the marital status. If you are married, you must file taxes jointly in order to receive a tax subsidy. If you file taxes separately, you can still purchase a plan, but you will have to pay the full price. Full-priced plans are unaffordable for many people. Eligibility for payment assistance is based on your tax filing household. You need to include information about any tax dependents, even if they don't live with you or they are not applying for coverage. The pre-screening is anonymous and asks basic information about you and other household members. The age and sex are required questions for the pre-screening. The pre-screening also asks several optional questions. While these questions are optional, it is important to answer them because they can help the pre-screening tool determine if anyone in the household might be Medicaid eligible. If someone is offered health insurance through a job, they might not be eligible for a tax subsidy if the lowest cost individual employer plan is considered affordable. There is also an optional question about tobacco use. It is important to answer this question correctly because there may be a surcharge for smokers. The pre-screening tool will also ask for the expected annual household income. Keep in mind that the tax subsidy is based on your current income. If your income has changed recently or you expect your income will change during the year, you will need to include the most current income information possible. It is also important to report any income changes as soon as they happen because it may change your payment assistance. Once you enter the basic demographic information and estimated household income, you will get an estimated monthly tax credit amount. This is not the amount the client needs to pay for health insurance. This is the amount the government will pay to the insurance company each month to lower the premium. When clients file taxes, they will reconcile the income on their healthcare.gov application with their actual income during the coverage year. If the income on the tax return is less than the income on the healthcare.gov application, they may be eligible for an additional tax credit. However, if the income on the tax return is greater than the income on the healthcare.gov application, they could owe some of the tax subsidy back. Clients may not want to use all of their payment assistance if their income fluctuates. In this case, the household is eligible for $646 per month in tax credit. They are also eligible for a cost-sharing reduction called Extra Savings if they choose a Silver plan. The plans are automatically sorted by monthly premium from lowest to highest. You can see a brief overview of each plan, including the monthly premium after payment assistance, the annual deductible and out-of-pocket maximum, and the coinsurance or copays for emergency room visits, generic drugs, primary care visits, and specialist visits. Clicking on the plan name will give you a more detailed explanation of plan costs and a link to the summary of benefits. If you click Refine Results, you can filter plans based on metal level, estimated costs, maximum monthly premium, maximum deductible, plan type, and more. You can also click the Compare checkbox to compare plans side by side. This is a helpful tool for clients who are deciding between a couple different plans. You can also note on this screen that the Silver level plans are marked with an Extra Savings banner at the top to indicate the lower out-of-pocket costs. If you click the box, See if providers and drugs are covered, you can enter names of your medical providers or prescriptions to find out if they are included in each plan's network. It is always the best practice to call your provider and verify which insurance plans they accept, because the search tool is not always up to date. Many insurance companies offer plans both on and off the marketplace, so if clients call their provider, they will need to specify that it is a marketplace plan. Page 14 in the Coverage to Care booklet has some helpful questions to help clients better understand their coverage, and includes questions like, how much will I have to pay for a primary care visit? What is my deductible? And would I have to pay a different amount if I see an in-network or out-of-network provider? These questions are a good knowledge check for clients to make sure they understand their new healthcare coverage.